Millions of seniors on Medicare Advantage plans will be impacted by a big change in 2026. Today, I'm going to talk about what that change means and what you need to do about it, so stay tuned. It's estimated that over 1 million seniors are going to be losing their Medicare Advantage plan effective January 1st, 2026. That means that if you're on a Medicare Advantage plan now, there is a real chance that your plan may not exist next year. And if you take no action, you could be facing big surprise medical bills starting next year. So why is this happening? Well, Medicare Advantage plans are based off of contracts with the insurance company and Medicare. So each year, insurance companies can decide which Medicare Advantage plans they want to keep for the coming year and which plans they want to drop. Similar things happen with Medicare Part D, right? Part D prescription drug plans are also contracted plans with Medicare. And these contracts can and do change every year. Now, in 2026, specifically due to new federal rules, tighter regulations, and higher costs, many companies are scaling back on the number of plans that they are offering. So that means that plans that were offered in 2025 may not be offered in 2026. So this isn't new. This has always happened with Medicare Part D prescription drug plans and Medicare Advantage plans. But usually what happens if you're on a Medicare Advantage plan that isn't being renewed for the following calendar year is that the insurance company will do something called crosswalking, where they will automatically move you to whatever is the most similar plan to what you have now that they will be offering in the coming calendar year. This still happens all the time, where if your current plan is discontinued, you could be crosswalked to another plan if you take no action to change your coverage. However, there's also the option that you're not crosswalked at all, which means that if you have a Medicare Advantage plan that's being discontinued and your insurance company isn't crosswalking you to a new Medicare Advantage plan, then you're just not going to have any other coverage except traditional Medicare Parts A and B, effective January 1st. In other words, if you're on a Medicare Advantage plan that's being discontinued and you don't choose a new plan prior to January 1st, then you could have no prescription drug coverage and be responsible for pretty high copays, deductibles, and coinsurance at the doctor and hospital. So how do you know if your Advantage plan is being canceled for the coming year? Well, the insurance companies must send you this information in an annual notice of change document. Now, the annual notice of change document has to be sent to you by the end of September, and the annual notice of change document will let you know if there are any changes to your plan for the coming year. It will let you know if you are being crosswalked to a new plan for the coming year, or it will let you know if your plan is just being altogether discontinued and you'll have no coverage next year unless you take action. So you really want to pay attention for that annual notice of change document coming in your mailbox. Don't throw it away. Make sure that you are opening any important mail from your current insurance company that's coming to you this fall. So what are your options if you are on a Medicare Advantage plan that's getting discontinued? Well, you essentially have a couple different options that you can choose from. One is going to be to simply choose a new Medicare Advantage plan. Now, you can do this between October 15th and December 7th every year. That's the Medicare annual election period, where anyone on Medicare can choose a new Medicare Advantage plan, and it will go into effect January 1st of the following year. Additionally, if you're on a Medicare Advantage plan that's being discontinued, you have a special enrollment period. If for some reason you missed the December 7th deadline, you would have until the end of February, 60-day enrollment window after your coverage ends, to choose a new Medicare Advantage plan if you wanted to, and it would go into effect the first day of the following month. Depending on where you live, there are many different Medicare Advantage plans available to you, and you really want to look at which plans have your doctors in the network. You want to look at how these plans cover your prescriptions if you take any medications. You want to look at what are the plan's copays, coinsurance, out-of-pocket maximum amounts, as well as if the plan offers any extra benefits that you may be interested in, like dental, vision, or transportation benefits. I do have a really handy resource on my website. I'm going to link more information in the show notes below, where you can plug all that information in and see side-by-side comparisons of the top Medicare Advantage plans for you based on your needs. Additionally, we help people with this in my office. If you have any questions, you can always give us a call. The other thing I want to mention, if your Medicare Advantage plan is being canceled, is that you have the opportunity to move back to traditional Medicare and add on a Medicare supplement plan. Now, everyone on Medicare essentially has two main options on how they're going to receive their Medicare coverage. You can either go with traditional Medicare, parts A and B through the federal government, which on average pays about 80% of your medical bills. And from there, you can add on a Part D prescription drug plan. And then most people will choose to add on a Medicare supplement, also known as a Medigap plan, that pays the 20% that traditional Medicare doesn't pay. Now, the other option is to do a Medicare Advantage plan, also known as Part C. These are kind of the all-in-one plans that include prescription drug coverage usually in the plan. They're like HMO or PPO managed care plans. So everyone will get the choice when they're on Medicare to do one or the other. Now, if you want to go this first path and choose a Medicare supplement plan, typically Medicare supplement plans are medically underwritten when you're not new to Medicare. So when you're brand new to Medicare, anyone can get a Medicare supplement plan and it's automatically approved to you at the preferred rate, no matter which plan you choose. But after you've been on Medicare more than 6 months, in most states, if you want to choose a Medicare supplement plan, you have to answer health questions, and depending on your health or your health history, the insurance company could deny you for coverage. So Medicare supplement plans are typically medically underwritten when you're not new to Medicare. Medicare Advantage plans, on the other hand, there's no medical underwriting involved. Anyone on Medicare is eligible for a Medicare Advantage plan as long as you have parts A and B and you live in the plan service area. But what many people don't realize is that if you're on a Medicare Advantage plan that's being discontinued and you're not being crosswalked to a new plan, then you have the opportunity to choose a Medicare supplement plan, and you are also given a guaranteed issue right to purchase certain Medicare supplement plans without any medical underwriting, because you've had this life event, this loss of coverage that qualifies you to get a Medicare supplement plan without medical underwriting. You have 63 days from the loss of your coverage to exercise this guaranteed issue right, but keep in mind that you can't choose just any old Medicare supplement plan that you want. There are certain Medicare supplement plans that are designated guaranteed issue plans. And while some insurance companies can vary and kind of make their own rules on which plans they want to provide as guaranteed issue plans, the general rule states that if you are eligible for Medicare before 2020, then Plan F is your most popular guaranteed issue plan. And you would have to actually go through medical underwriting if you wanted to apply for Plan G or Plan N, which are the other popular Medicare supplement plans. However, if you are eligible for Medicare in 2020 or later, then Plan G is your most popular guaranteed issue plan, and you would have to pass through medical underwriting if you wanted to get, say, a Plan N or a non-guaranteed issue right plan. It can get a little bit confusing in the weeds when we start to talk about guaranteed issue plans, how they work, which plans are guaranteed issue or not. So that is something that we help seniors with in my office every day. We're licensed in 48 states and we work with over 30 different insurance companies. So we're very well versed in which plans might work best for you based on your needs, your health, and your budget. So the big takeaways that I want to summarize here are that millions of seniors are going to get impacted by the loss of a Medicare Advantage plan in 2026. It's very important to pay attention to your mailbox and look for that annual notice of change document. Don't ignore it, because even if your plan isn't getting canceled next year, you're likely going to see pretty significant changes to your Medicare Advantage plan for the following year, and that will all be outlined on that annual notice of change doc. If your Medicare Advantage plan is getting discontinued, then you can always shop for a new Medicare Advantage plan. Everyone on Medicare can do this every fall. However, some seniors on plans that are being canceled will also have special guaranteed issue right opportunities to purchase certain Medicare supplement plans if they want to go back to traditional Medicare and add on a Medicare supplement plan. And depending on your health, this may really be the best time to do that if you think this is the path that you want to go moving into the future. Now, again, we help people with both options, Medicare Advantage plans, Medicare supplement plans. It can be confusing, and there's a lot of information floating around out there about which plans are bad and which plans are the best. But really, there's no one right Medicare plan. Every person is going to have different needs, a different budget, and a different plan that will be best for them. So that's what we do here in my office, is help seniors, many of whom find us right here online every day, to find and secure the best Medicare plan for their needs. If you have any questions about this topic, please leave your questions and comments for me in the comment section below. I really enjoy hearing what you have to say. Like this video, please subscribe if you haven't done so yet, and share this video with someone who may find it useful. There will be over 1 million seniors impacted by this change next year, and it's really important that they fully understand their options. Thank you so much for being here today. We'll see you soon.